Good evening, guys. I have your discussion C for you. We're discussing bone density in women. Okay, so here's the presentation I made for you. Here's a clear explanation grounded in the page you're viewing. What the headline means. The text refers to a breakthrough by scientists at Pompeu Fabra University. They've developed a computational model that predicts hip fracture risks in women with osteoporosis by analyzing only 7% of the hip joints instead of needing to study the entire bone. The model zeroes in on critical areas that carry the most diagnostic weight. The team uses 3D reconstructions of the hip generated from routine 2D x-rays, then applied advanced statistical methods to identify which regions mattered most. They found that just 7% of the bone mass, the critical zones, contained enough structural information to predict fracture risk. This approach reduces noise from less relevant areas and concentrates on the biomechanical weak points most likely to fall under stress. Why this matters. The model reaches 95% accuracy in predicting fractures, a remarkably high level of clinical diagnostics. By narrowing the focus, it could streamline osteoporosis screening, making it faster, cheaper, and less invasive. Clinicians could use this tool to spot high-risk patients earlier, guiding preventative measures like medication, lifestyle changes, or targeted monitoring. It also suggests a shift in thinking. Not all bone tissue contributes equally to fracture risk, so precision targeting may be more effective than broad assessments. How they validated it. The study examined 90 women with osteoporosis. Half had already suffered a hip fracture, half had not. Comparing their hip reconstructions allowed researchers to isolate the predictive zones. The validation shows the model can distinguish between fracture and non-fracture cases with a small margin of error. Bigger implications. Healthcare systems could benefit from reduced imaging costs and more efficient diagnostics. Patients may face fewer unnecessary scans and quicker identification of risk. Policy and practice. Such models could be integrated into routine osteoporosis care, especially in resource limited settings where full imaging isn't always available. Research. It opens the doors to applying similar critical zones analysis to other joints or conditions, reframing how we think about structural vulnerability in the body. This isn't just technical advance, it's a reframing of osteoporosis diagnostics by proving that small slice of the hip tells the whole story. The model challenges the assumption that more data always equals better prediction. It's a reminder that precision, not volume, often drives progress. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, guys. Have a good night.